Canine.
Canines in between.
Incisors.
Okay. So on the premolars and the molars, what we're going to need to do is kind of look at the pointy ones as the premolars and the flat one as the molar.
Okay. So pointy.
Pointy premolars, flat molar.
Okay.
All right, so then on the roof of the mouth, we have the hard palate, where those ridges end back here, and sometimes it's hard to see too, where it starts to smooth out kind of way back here, where you don't see the ridges. That's the soft palate.
Okay.
All right, so then tongue, not on there, but there's two things on the tongue you have to know. So the first thing is where you have that red thing, so that's the frenulum linguae, or the lingual frenulum.
Wait, the red thing? Which one? Oh, yeah, I got you. That little...
Yeah, the thing that holds your tongue down. And then the other one on the tongue is the papillae, which are kind of the kind of taste bud kind of area. So they actually have those up here on the roof of their mouth, but because this is a hard palate, we got to ask it on the tongue. Okay, because tongue's not an option, so papillae. All right, so then on here, you got your parotid gland. Okay, so right next to the masseter, the parotid gland. For pharynx, because it's on there twice, but pharynx, it's not really a structure, it's a space. So what we would do is stick something down here and have a note card with like common passageway for food and air. Oh, pharynx.
Okay.
All right, moving down, we have the larynx, which is this we saw before. So this cartilage section right here.
Okay.
The trachea is underneath it, the ridges here. And then on the below that and to the side, so again, you can cut through any muscle you want here. So I cut through all that.
Okay.
But below this is a soft, flat pouch tube, really. That's the esophagus. So if you cut some of this muscle on this side and just kind of push this over to this side, you should see it. Is that it? Hold on. That's it. Ah! Okay, so we're going to move this over. This kind of flat pouch.
Oh, okay.
That's right there. Yours looks so weird. Okay,
He's so
hold on.
little.
He is little. Here we go. Is this it? Oh my gosh. Okay, that's better. That's better, clearer part to this. So that, as long as you get this separated, you should see it right there. So that pouch. Okay, that's the esophagus. All right, since we're still moving down this way, let's just go and do the respiratory. So again, just cut that. You have it all open.
Okay.
For the lungs,
We do know how far high, how far.
just cut it all the way. There's 7 lobes of the lung. They actually have multiple, more than we have. So you'll need to know either calling this superior or anterior. Medial is the middle one, and inferior or posterior is the bottom one.
Okay.
So you have right and left, so both sides. And then there's an actual extra one that's not on your list, but I always like to point it out. It's right underneath the heart. It's just this extra lobe of the lung. It's the mediastinal lobe right in the middle. Kind of interesting to have another one. We've got the diaphragm, liver, gallbladder, good. Spleen is this thing right here.
Okay.
This is the greater omentum. As far as layers are down here, so if a pin was over here or in the sides, this would be the parietal peritoneum. So layer, that's why layer, there'd have to be a card layer on it. If it's on any other organ, and with the word layer, that's visceral peritoneum. So parietal peritoneum, visceral peritoneum.
Okay.
Down here, your little urinary bladder is stuck within all this fat. So that's your urinary bladder. The tube that comes off of that down here, and you're gonna have to
Right there.
move some of that fat off with that tube right here. That's the urethra. And then let's just go ahead and do the ureters here. So if I pull on the urinary bladder, you should see kind of this tube and this tube over here. So that's the ureters. So if I pull this one and this one.
Okay.
So ureters, and those go to the kidneys.
Okay.
You can take all this fat off.
Okay. we didn't know if there was
take
other.
all that off.
Gotcha.
Nope, take it all off. All right, where's your kidney? Oh, here it is. Itty bitty thing. All right, so we have the hilum, which would be the opening in here. So renal hilum. You have the capsule. It's that right there. The outer layer. On the inside of the kidney, you have the cortex, which is this outer layer. You have the medulla, which is this one. And then, all right, so then we have the pyramids, which are these sections in here.